In the spotlight.
Hello, and welcome back to the Hospital Association of Southern California's podcast series, In the Spotlight. I am Susan Harrington, President of Communities Lifting Communities, and I'm thrilled to be your host today. Today we are going to discuss our Advancing Health Equity and Economic Opportunity through Regional Collaboration and Healthcare Anchor Strategies initiative, which aims to convene, engage, and support hospital leaders in multiple roles, including our executives, human resources, procurement supply chain, diversity, equity, inclusion, and community health managers who are advancing health equity. It's an honor today to introduce you to our esteemed guests, Signe Gilbert, Director of Education, and Rachel Villanueva, Education Specialist in the Professional Development and Education Department at MLK Community Healthcare. Welcome.
Thank you. Thank you for having us.
We also want to highlight Rachel's esteemed work as she was one of our HASC Hospital Heroes in 2023. Congratulations.
Thank you so much.
Today we have the privilege of learning more about MLK Community Healthcare's groundbreaking workforce development program and discovering how these initiatives have revolutionized their integration of being a culturally aligned workforce. We want to learn more about your work today, and welcome again. So first, could you please share some of the information about yourselves and MLK Community Healthcare?
Yes, thank you, Susan, for having us. Again, my name is Rachel. I have worked at MLK Community Healthcare for about 5 years, and before that, I actually worked at the Walt Disney Company for about 10 years. I love what I do at MLK Community Healthcare. I'm a strong advocate for training and development and upskilling our own staff who also come from the community of South LA. In addition, I love to bring the departments together. I am also supportive of our non-clinical and our ancillary departments such as foods, EVS, transport, public safety, and facilities. Some of the background departments that are not really front-facing to patients.
Thank you.
And I'm Signe Gilbert. I'm the Director of Education and Professional Development at MLK Community Healthcare. And I recently joined the team in December of 2023, where I came from a hospital system in Georgia working on nursing pipeline initiatives. So very excited to join this innovative hospital. A little bit about Martin Luther King Community Healthcare is that we opened in 2015, really from the need for the community, and all of our programs are based on community needs. So we're very, very proud to be a 5-star rated CMS hospital, leapfrog grade of A, and then we're also a diabetes center of excellence.
Congratulations.
Thank you.
Could you provide some insights into the common strategies employed by MLK Community Healthcare's workforce development programs?
Absolutely, Susan. We wanted to make sure that we have a culturally aligned workforce so that we're employing those that live in our community and helping them to develop, to have better skills, to work inside our hospital.
In addition to, I think we also listen to our employees. So we love to do employee roundings. We like to hear what's going on with our staff. We do exit interviews as well as our employee engagement survey annually. So we get to hear their voice as well and what their needs are from us.
So what unique benefits to the employees and your organization does this program provide?
Yes, Susan. So I feel like there's twofold in this. What is it that the employees obtain, and what is it that our organization can obtain? So the first and foremost thing is after our staff obtain their high school diploma equivalency, they're able to pursue their careers in other departments such as phlebotomy or becoming a certified nursing assistant, a PCT, even a sterile processor.
And then from there, it really creates this loyalty for the organization. We have a solid, steady workforce that, since we invested in them, they're investing in us, and it creates better stability and better care for the community that we serve.
These are wonderful benefits that you've shared. So with any program's success, there are going to be challenges. What kind of challenges have you had, or have you faced or solved?
So it's become, everybody has heard about the programs that we're able to implement for our organization. And it's difficult because we can't accept everybody, every single student. So that's some of the one of the challenges that we have right now. Sometimes it can also be lengthy, so I can have Signe discuss that with us.
Sure. So out of the HiSET program was really what other opportunities can the hospital provide for our employees, and looking at, we have a lot of temporary labor, which I know hospitals can relate to, right, across the country, not just in South LA, and really being strategic about what programs can we offer internally to help build for those hard to recruit positions, so such as phlebotomy, our PCT, mental health aides, those types of things. So with that, it's getting out to the schools and developing those relationships, and then ultimately working on those affiliation agreements, which can be a lengthy process.
What advice would you give to your colleagues when they're considering developing a similar initiative or program at their hospital?
I think it's really just diving right in, not being afraid to try something. Doesn't have to be perfect to start, but just really being innovative and being a trailblazer, and listening to your employees.
I think that it's easy for any organization to accept the status quo. There's always that quote that we've always done it that way. But here at MLK Community Healthcare, we can't say that because we've only been around for less than 10 years. So for us, with our executive directors and especially our CEO, Dr. Batchelor, she prides herself on innovation. I myself, having my background at the Walt Disney Company, I prided myself on creativity and innovation too. So I was grateful for the opportunity to sprinkle in some pixie dust into MLK and to help our community and build them up. Because all of our students that we have in our programs all come from our community. So 100% of our staff are all from our community.
So how many staff have gone through your program so far?
So I know that there are about 17 current staff members that are a part of this high school equivalency program. We started back in 2021 with 7. So there are about 4 in our Spanish cohort and 3 in our English cohort. So there were actually 2 different languages that we were conducting 2 different programs for at that time. There are now other departments aside from environmental services that are a part of this program as well. So we've opened it up to public safety, revenue cycle, medical staff, as well as our PBX operators and our parking staff as well. I think the biggest part of having such a diverse group of departments as well as folks that are within the community is that some of them are afraid to speak up. And us in our department for professional development and education, we want them to succeed. So we want them to be excellent. We want them to succeed. We don't want them to be afraid to excel or to grow. We don't want them to be afraid to ask their leaders, hey, what can I do to be better, to become better? So
Thank you.
Thank you.
So Signe and Rachel, thank you so much for being here and providing your insights for this very special program. Your insights have been very valuable, and I extend our sincerest thanks to our listeners, our hospital members, and for both of you and the time that you've taken to enrich our discussion with your model. Thank you.
Thank you, Susan.
In the spotlight.